to you because this is obviously something that's on lots of people's minds. As a Democrat, do you support my body, my choice? What about parental choice? Why do you think our current vaccination system isn't working? Why did you choose to sponsor HB 3063? This is for Ms. Power. And what is your goal? How are the lives of the greater good valued over ones that are affected by vaccination? The people that opt lifelong illness or death. How can you validate vaccination that doesn't have proper studies done or open to regular court? In regards to HB 3063, what is the state of emergency that would justify a change in the status quo? Is there more illness in our state? Some individuals are susceptible to poor infection outcome. Others are susceptible to poor vaccination outcome. How do you choose which person is more important? Are you aware that we already have 95.6% vaccination rates in Oregon? 100% doesn't result in no outbreaks. Will mandates around vaccination be part of the health care bill? I think that these are representative comments.
Terrific, thank you. And I don't think you're on the bill, I think it's just me.
Well, we can't sign on until it comes over to the Senate.
Right.
Can I also add, can you add a constituent coffee specifically for this reason, since so many of us are here for this and we only have about 10 minutes left?
Yes.
Let's okay, so I want to clarify something about process here, is that the way that the Oregon legislature works regarding whose names are on which bills, a bill starts in the House, and if it is filed before the legislative session starts with a specific deadline, then both senators and representatives can put their names on a bill. Once that filing date has come and gone, then the bill has to move out of one chamber, and then when it goes to the other chamber, and so in this example, Representative Power's name is on this bill, but when it comes over to the Senate, I plan on putting my name on the bill as well. So I don't want there to be any idea that somehow my name is not on the bill, but it will be as soon as it passes out of the House and come over to the Senate. So go ahead.
Yeah, for those of you not following this very closely, some of our colleagues have worked on a bill called House Bill 3063, and the current base bill mandates a number of different vaccines, effective, I think, immediately under the base bill. And it was brought by some of our colleagues who work or are medical professionals in response to the measles outbreak, both in Vancouver and around the country. I know there's a particularly bad one in New York City right now, where New York City is mandating vaccines as well. So when my colleagues started working on this, I asked them to include me in the conversations as well. So for those of you who haven't seen Grady running around at one of our constituent coffees, I have a two and a half year old, he's a little bit more than 2.5. And he is allergic to eggs. Bad enough that we carry around EpiPens everywhere we go. And they're currently expired, of course, because we know that there's an EpiPens shortage. So as part and parcel of the conversation around people who have vaccine reactions, my son has had them. We wait and he has gotten his full suite of vaccinations because, my wife and I believe that we've both had family members get sick in the past, and some folks older in our family who didn't have the opportunity to get vaccines, who suffered reactions. We sat down with his pediatrician and made the personal decision that we'd rather him be protected against things that could be potentially life-threatening. He has had vaccine reactions. And so as my colleagues were talking about this from a medical standpoint, I wanted to jump in on the conversation and make sure that even though, so I think to Senator Taylor's point, our colleagues work on bills that travel through committees that we don't touch, see, or sit on. And unless we sign on to them, we don't, our staff really don't have capacity to track things that are not in our committee, because it's our individual responsibility to be working on the bills before us, for our colleagues. I do not have a healthcare background. I'm not on the healthcare committees, but I do have a son who is impacted either way, and I think my wife and I have had to sit through a room with our pediatrician where he has had reactions. And we still felt very important along the way to make sure that we're safeguarding him against far greater, I think, public diseases that can be communicable. I also have a very good, and so this for me was a personal decision to sign onto the bill so I could follow it more closely. Not only does that affect my son, but a very, very close friend of ours had 2 horrific late-stage miscarriages. And she's had significant and very traumatic problems having children. She had her first daughter in the middle of the whooping cough outbreak in Washington State. And watching her go through that emotionally was one of the worst things I've ever seen.
Okay, that's great.
So I know that our colleagues are working to receive feedback. This was something that received a large amount of feedback when it was in committee. When bills go on to Ways and Means from policy committees instead of going to the floor, we go through a slightly lighter touch process. And so this bill is currently went through the policy committee, the healthcare committee, and is in our Ways and Means committee. I think the women who are on the bill have been working on receiving that feedback, and I believe that they're working on amendment. That's what they told me, and I've sort of asked them to keep me in the loop as they go forward.
So speaking about vaccinations in general, and I know that there's quite a bit of interest in this subject, is that, we work on, obviously there's a whole host of health-related bills that come through the legislature, not just here in Oregon. All 50 states have a significant number of healthcare bills that go through legislatures, and Congress deals with this also, regardless of everything to do with kidney disease to lung cancer to a whole host of things. Just imagine all the subject matters that come through legislatures across the whole country that have to do with healthcare, okay? This is one of them. I'll speak for myself, I rely heavily on